I'm Elly Katabira. I'm a professor of medicine from Makerere University College of Health Sciences. I'm also the international co-chair of this conference and president of the International AIDS Society.
There is now talk about ending AIDS.
Yes.
What is your comment on this discussion?
My comment is that it is a focus and a hope, an objective, which we need to. Because if we don't, then we are not continuing to do things the same way. The ending of the epidemic is not easy. Everybody knows it is going to be difficult. But it ignites us to be more innovative in order to achieve it. The best example is what has been said before, that in the 2000s, nobody ever thought we would be able to have antiretroviral drugs in third world countries. But we said we must have them. We now have them. It's not perfect, but at least there is a drive now not to stop it, but to do better so that more people are put on antiretroviral therapy. The same thing about HIV, ending AIDS. More people are going to do much more work to become more innovative to ensure that that objective is reached some time to come.
What is the biggest obstacle to achieve this goal?
I think the biggest is complacency and doubt. Many of the people, both scientists and politicians, particularly politicians who are important in investing in the cause to make sure that we end the epidemic, some of them are still skeptical and think it is not possible. We need to convince them, particularly we, the scientists, to do work and research and provide evidence for them so that they can use that to invest more in getting there as we would like it to happen.
The slogan for the conference is turning the tide together.
Yes.
What is the key message here?
The key message here is to work together. The days of doing things on our own is over. The days of leaving it for the donors because they have the money to give us the money and we do things is over. We need to work together with the donors, with the communities, with the health workers so that we get the one goal. What has been happening in the past that we, particularly in the research in third world countries, we've been sitting back and waiting for the basket to be filled by somebody else, forgetting that even ourselves in our own areas, we can still contribute a lot, not only in funds, but also in reorganizing our health workers, our health systems, to make sure that what we get from the donors is used properly and effectively to improve and make sure that more people are put on treatment. There are more people prevention of, for example, mother-to-child transmission. All this needs to be involving all of us at grassroots as well as within the administration and the policy makers.
What is the responsibility for the developed countries and for the developing countries to make an end of the AIDS epidemic?
For the developed countries to continue supporting us, but more important for the developing countries is to invest more in our health systems so that what we get from the developed country can be used more efficiently. There is a lot we can do ourselves to make sure that what we get is value for money. Cut out wastes so that, for example, in Uganda we have a lot of people who need to be on treatment who are not yet on treatment. But it is not because we don't have enough money. It is because some of it goes to waste because we spend time taking so long to deliver drugs where they're supposed to be, and sometimes, believe it or not, sometimes drugs expire and have to be destroyed. This shouldn't happen because if we can be more efficient and make sure that all these drugs are distributed at the places where they need to be, then everybody will be able to access them. And secondly, we also need to put in a culture whereby even we as countries, much as poor as we may be, we contribute so that we add on to what we get from the donors for that purpose.
What is your key message at this conference?
At this conference is mainly to thank the American people because they have been supporting us. Even though we haven't been coming here for 22 years, they have continued to support us. The PEPFAR, the Global Fund, and so on. All those have been made possible to put many people on treatment. But more important than that, the training. Many of the health workers across the globe have received the training either within their countries through the support of the American people or within America. And that training has been crucial in ensuring that we deliver healthcare services properly, to ensure that we actually close to implement what we call this treatment as a prevention, and even aiming for the end of the epidemic, because our people have been trained. And they have also trained others as a result. That, to me, that is extremely important, because it's not money alone to the patient, but also for the healthcare. It's no use giving someone $100 million when there's no one who knows how to give the drugs.
When the International AIDS Society was founded 24 years ago, 1988, by Dr. Cullings and Dr. Bolberding, it was a very small organization with only one employee. Today it's a big organization. How do you see this development?
It is good, because it means more people are getting involved. You can't believe my just being a president of the International AIDS Society for 2 years has raised, almost trebled, the membership from African region. And the reason is that now people appreciate the use and, of the International AIDS Society. But I think the other major contribution is the change with the trend with technology. As you remember, in 1988, there was no internet. If you wanted to communicate to me, you had to send a telex, and there is no guarantee that I will get it. Today, if you want to talk to me, you pick up a phone. No matter where I am, I'll pick it and answer to you instantly. If you don't have a phone, you can send me an email and I'll answer you. That kind of communication has eased the way IAS communicate with their members. And now people are appreciating the value of the International AIDS Society. And that's why we have grown big.
Are you optimistic?
Very optimistic. I've always, otherwise I wouldn't be here.